This is Melanie Longenecker. Welcome to our presentation on adolescent obesity. Did you know adolescent obesity is increasing at alarming rates? Did you know that teens who are overweight suffer from poorer quality of life and develop chronic conditions? So today we're going to look at who does it affect, what does it affect, and what can be done. So first, let's go ahead and take a look at normal adolescent development. So during this time period, your teen is going to have a growth spurt. They're also going to develop increased muscle mass. They'll start going through puberty or their sexual maturity, and a natural result of sexual maturity is the addition of fat cells within the body. They're going to have increased blood volume, stronger cardiac contractions or a stronger heart rate, and a natural rise in blood pressure as a result. Your teen also has a lot of normal psychosocial development going on. This is when their sense of identity develops. Their moral and spiritual development will take shape. They have concern with their body shape and image, and it's very important their peer relationships and their opinions of peers towards them. They're emerging independence, and they're starting to understand their own sexuality. So who does adolescent obesity affect? So this slide is information gathered from the National Center for Health Statistics that was published in 2015. The study period was 2011 to 2014. It studied obese teens between the ages of 12 and 19 years. Our first column, the green and the blue, are a comparison of males and females, and we can see in the blue column that females have a higher rate of obesity compared to males. Our local population is largely made up of white and Hispanics, so the orange and yellow columns are representations of our local community, and we can see that the Hispanic population has a higher rate of teen obesity compared to the white counterpart. And then I compared two ethnic groups, the one with the lowest amount of teen obesity and the one with the highest. And we can see that Asians have the lowest amount of teen obesity and Mexicans have the highest. So what does adolescent obesity affect? It affects multiple systems within the body. First, let's go ahead and look at the cardiovascular system. So again, our normal development here is some increased blood volume, strong cardiac contractions, a natural rise in blood pressure, and they have an increased need for iron in their diet to support all of these growth activities. So what happens if your teen has obesity? They're going to be at risk for hypertension or high blood pressure, and that risk is higher in girls. They're also at an increased risk of early coronary artery disease. They can also be prone to iron deficiency anemia during this time. And you know, iron deficiency anemia is higher in girls by a 3-fold margin compared to males. Teens with iron deficiency anemia, it can lead to fatigue, mood swings, and poor concentration. Iron deficiency anemia is thought to be the byproduct of poor teen diet, eating away from home more often, and the availability of fast food. Looking at the respiratory system, your adolescent has a normal baseline respiratory rate. They're breathing 16 to 22 breaths per minute. They've got adequate lung volume and adequate ventilation. But what happens to this system when they have obesity? The obesity actually decreases their lung volume, which can lead to a high risk of developing asthma. Did you know that asthma is the leading cause of school absence in children who are ill? Asthma is poorer controlled in females, and our African American teens with obesity at our highest risk for developing asthma related to obesity. Obesity also can cause sleep apnea, and we know that children with sleep apnea are poor test takers. Looking at the urinary or the kidney system, during normal development, our teens have normal filtration in their kidneys, they've got a normal sized bladder, and they've got good, strong muscle support for that bladder. But what happens when they have obesity? They actually develop an enlarged kidney. And that enlarged kidney allows more blood flow into the kidney, which leads to a dysfunction in the filtration rate. So that altered kidney filtration rate may lead to chronic kidney disease. And if chronic kidney disease is not treated, it can lead to end-stage kidney failure. Teens with obesity are also prone to developing kidney stones and urine leakage. What happens in the reproductive and endocrine system? We already know as a result of maturity, they have increased fat cells distributed throughout their body. That changes a shape in their body. They've got increased hormone production, which is happening because of that sexual maturity. And they also have decreased insulin sensitivity. And we know teens have decreased physical activity during this time. So what happens when we add obesity into that equation? Those increased fat cells that are living in their body now are what's going to lead to that excessive weight gain. Excessive weight gain may place females into early puberty. And early puberty puts females at risk for developing type 2 or adult onset diabetes. Women who are obese are also more likely to have polycystic ovarian syndrome. And then there are two endocrine disorders that can lead to obesity in your teens, and they might be Cushing's syndrome and hypothyroidism. There are also some hormone-related cancers that are also at risk when you develop obesity. Breast cancer is one type of hormone-responsive cancer, and obesity increases your risk of developing breast cancer. So what's going on in the GI tract, or the gastrointestinal tract, and your musculoskeletal system? So this is where they had that growth spurt and they get taller. They also develop lean muscle mass, and that's seen more in the boys rather than the girls. But because of that new muscle mass, they're going to try out some new sports and some new activities. But at this time also, we know that their quality of their diet actually decreases. So let's add obesity into that picture. And it's going to affect their GI system, and it's going to put them at risk for gastric reflux, gallstones, and fatty liver. Because of the excess weight, they're going to have a higher fracture rate. That excess weight can lead to muscle pain, and that can eventually lead to physical disabilities and eventually osteoarthritis if not treated. The brain and central nervous system is also being affected. So during adolescence, the brain continues to change during that time period. They have increased electrical activity and they have increased neurotransmitter activity. What happens to the teen's brain when they have obesity? There's a condition called executive dysfunction. And that's where the brain actually sends a signal that says, increase your intake and decrease your activity. And that becomes a loop cycle that prevents your child from losing weight. Studies have indicated that weight loss will improve executive functioning. Teens with obesity also suffer from poor motor performance. They have a loss of balance and agility, their motor skills are not as good, and their coordination is not as good compared to non-obese teens. We also know that obesity leads to decreased attention and concentration. So what happens to the skin and the immune system? Normal development, they're going to develop some oily skin and the appearance of acne. We know that teens sleep less, which can create some stress, and we know that their body image is changing during this time. So what happens with the teens with obesity? They may have some stretch marks, lower self-esteem. We know that increased appetite is related to decreased sleep time. And teens during adolescence have a lot of stress. We know that stress plays a factor on the immune system, and stress will actually trigger the immune system to increase fat production. We know that obesity is also an inflammatory process, and part of that inflammatory process is related to increased junk food consumption. The immune system is also influenced by obesity and creates susceptibility in your teen. A study conducted during 2009 during the H1N1 flu epidemic showed that teens who were obese had increased levels of obtaining H1N1 than their non-obese teens. So what can be changed? What can we do? What can't be changed? Let's go ahead and we'll start at the bottom and we'll work our way up. So we know adolescent obesity can lead to cardiovascular disease, asthma, sleep apnea, kidney disease or renal disease, and low self-esteem. So let's go ahead and look at that dark blue box, modifiable factors. These are things we can change to improve quality of life and our health of our teens. What can we change? We can change their diet and their physical activity and the environment. How do we do that? Move up to the two orange boxes. The dark orange box says education. Who do we want to educate? We want to educate parents and teens. We educate them on diet and activity. But we also want to educate the community. For families who rely on food banks as a supply of their food source, we want to educate the community to provide nutritious food items that they can be available at food banks for distribution. We also want to encourage the community to have safe recreation areas so children can be outside and physically active. And we also want to support our community in endeavors for school programs, for nutritious food items, and for good physical activity programs. So what can't we change with teen obesity? We'll look at the light blue box for the non-modifiable factors. There we look at familial and genetics. So did you know that if both parents are obese, there's a 60 to 80% chance that your child is going to be obese? And that 1 to 5% of obesity is caused by endocrine or genetic disorders? We also know that your child can improve their income or their neighborhood. So how can we make things better for these non-modifiable factors? So we move up to the purple boxes, and the dark purple box is first the medical community. We rely on them to screen and diagnose these conditions. And we move over to the light purple box, and we look to the public. And we're looking there at the state, local, and government levels, and we're asking for support of good, nutritious, healthy living, and free programs for children, whether it be for nutritious meals or physical activity, so all of our children can take advantage of everything that they need to grow up healthy. So let's go ahead and look at a care plan for adolescent obesity. So always our first plan is to prevent. That's our primary initiative, prevent it. Secondary, we treat and we diagnose. And third, we move on to managing if necessary. So how do we prevent adolescent obesity? First thing is we can improve diet quality by stocking fruits and vegetables at home, eating meals together as a family, limiting the amount of fast food that we consume, drinking more water, and avoiding sugary drinks. We can also change the environment that our teens are in, and that would mean limiting or having less screen time available for them, promoting more activity, and getting them out to those safe play areas. We also want to encourage maintaining a healthy weight. And how do we do that? We teach them to avoid vending machines, be physically active, and participate in school physical education. Secondary, we diagnose and we treat. So we look at behavior changes. What can we change? We can change eating habits, we could set goals for weight, and we can educate. We also have counseling available to assist us. There are support groups, parental education, and behavior modification programs. We also have diets available. Diets should only be followed with your physician's guidance. There's a multitude available. So we have low carbohydrate, low calorie, low glycemic load, and of course we have portion control. What do we do if your teen develops obesity or any of the complications resulting with that? There are medications available, but we only try weight loss medications after all other measures have failed. And for severe obesity, where your teen is suffering from poor quality of life and from chronic conditions, there is surgery available. We also treat any chronic illnesses that developed as a result of obesity. We want to screen obese teens for diabetes and catch that early if it develops and treat it early. We also want to screen obese teens and watch their lipids or their blood fat levels. If they've developed too high levels of lipids or blood fats, they're going to be at risk for developing that early cardiovascular disease. So we have technology to assist us also. With the age of the smartphone, there are multiple apps that can help us with weight loss, weight maintenance, and so we have one app called My Meal Mate. This app is a replacement to face-to-face counseling. It's always available to your teen, no appointments necessary, no travel time back and forth. It self-monitors food intake and their physical activity. It allows them to set personal goals and get responses back from this app. It promotes behavioral change, and it gives them the feedback necessary to meet goals and make daily changes. So what's our conclusion? Teen obesity is increasing at alarming rates. Adolescence is a time of great change. Teen obesity leads to poor quality of life and chronic illness. Prevention is our first step for improvement.